Okay. Hi, everybody. It is 12, so let's get started as people continue to arrive. I want to extend a warm welcome to you and thank you, everyone, for joining us for today's Wellness Wednesday. My name is Romina. I'm one of the program assistants for the BC Brain Wellness Program, and I get to be your MC for today. As you probably know, our today's talk will be about how to beat the winter blues, in which we will explore common symptoms of seasonal affective disorder, feeling down and lethargic during the winter months, and how these symptoms relate to seasonal changes in biological rhythms. We're also going to discuss management strategies for treatment and prevention, alongside some practical tips. But before we do that, I want to take a moment to acknowledge that the BC Brain Wellness Program at the Javad Morphagian Center for Brain Health resides on the traditional, ancestral, and unceded territories of the Musqueam peoples. And it truly is a privilege to be able to offer a program on their land. And it is important to take a moment and recognize the land on which we live and operate. So as we join from various I invite each of you to reflect on your own connections to the land you inhabit and its history. But without further ado, let's move on to introducing our esteemed speaker today, Dr. Raymond Lamb. Dr. Lamb is a psychiatrist, professor, and BC Leadership Chair in Depression Research at UBC. He's also the co-director of the Mood Disorder Center at the Javad Morphagian Center for Brain Health. Dr. Lamb specializes in depression research and care, and he is the co-editor of the CANMAT, my apologies, depression guidelines, which are the most widely used clinical guidelines for depression in the world. And I would also like to take a moment to thank all of our program donors for supporting the Brain Wellness Program. We can only provide these events and classes thanks to your generosity. Also, a couple of housekeeping notes before we dive into the talk. There will be a Q&A session at the end. So if you have any questions for Dr. Lamb, please type them in the chat box or send me a private message if you would prefer. Please make sure to keep your microphones muted throughout the entire talk. This presentation is being recorded and will eventually be uploaded to our website and YouTube channel within about 2 weeks' time. In addition, we are actively recruiting for 2 research studies. We are currently recruiting more individuals with Parkinson's for our Impact 360 study, which is looking to understand health impacts of a combined exercise, cooking, and mindfulness intervention. Also, we have an ongoing dietary intervention study, which seeks to understand the impact of diet on symptoms and the microbiome of those living with Parkinson's. Please pass the message on if you know someone who may be interested. And all of these interventions are of no cost to you at all. So without further ado, I will pass the mic to our speaker. Welcome and thank you, Dr. Raymond Lamb.
Thanks very much, Romina, for the kind introduction. It's a pleasure to be here and welcome everyone from the Center for Brain Health. I'm pleased to be talking with you about some tips for helping to beat the winter blues. It's a big topic right now. In fact, I was just quoted in the New York Times article today on a similar topic about light therapy. So what we're going to talk about is actually, what are the winter blues, who has the winter blues, and how it might be different from seasonal affective disorder, or SAD, that you may have heard about. We're going to talk specifically about light therapy and how it might work. We don't really know, but there are some major theories, and especially how light therapy may be able to benefit other conditions besides winter depression. And then I'll finish up with 5 tips for you to prevent or beat the winter blues. And maybe the last one will surprise you. So when we're talking about winter blues, we're really talking about seasonal changes in mood and behavior that affect many people from summer to winter. And it's pretty clear that many people have these seasonal changes where they don't feel as well in the wintertime compared to the summer when they're feeling perfectly fine. And so when we talk about winter blues, we talk about these seasonal changes in both mood and physical symptoms from summer to winter. What kind of physical symptoms might people experience? Well, we call it the Garfield syndrome. Most of you know Garfield. And the symptoms that people experience in the winter compared to their summer selves are really things like increased appetite, carbohydrate craving, gaining weight in the winter, and in part because of low energy or fatigue that they experience in the wintertime, and oversleeping. So having problems with needing more sleep than usual in the summer, and having trouble waking up in the morning time. So these are all some of the physical symptoms that people experience, but they also have changes in their mood, in which they feel depressed, not as interested in doing what they usually like to do, and not being able to participate in activities the same way that they would in the summertime. Now, we think of it as a dimension, of course. So there are people who are more or less seasonal. I myself actually am not that seasonal, so I don't have that many changes in the winter. But many people have mild changes, and some have more moderate changes. And for some people, they have much more severe changes. And we'll talk about that in a second. But it might be about a third of the population really do experience some of these seasonal changes in their mood and behavior. Now, these types of symptoms and these winter changes are more likely to happen in women. Now, women are more likely to have depression overall. So that might not be that different, but they are more likely to have some of these seasonal mood changes as well. Particularly youth, teenagers, and young people are more likely to have it into middle age. People get less seasonal as they get older. And so, that there may be some reasons for that we'll talk about as well. And this is definitely a Canadian problem because the winter changes reflect higher rates as you go farther away from the equator. So as you go farther north, people have more trouble with the wintertime. And this might be because it's related to the shorter winter days and the longer winter nights that occur in northern latitudes compared to closer to the equator. And just for reference, we see similar changes in the southern hemisphere as you go farther south in the southern hemisphere in terms of the winter problems. So these changes, why do we say it's related to the shorter winter days and longer winter nights? Well, we know that in northern latitudes, of course, the changes in the day length are more exaggerated between winter and summer. And this is kind of a neat way to look at it. It's a graphical representation. I'll take you through it. These are the months of the year along here. The dark areas represent nighttime. The yellow areas represent daytime. And so you can see in the summer months, May, June, July, August, the nights are short. The days represented here from 12 midnight to 12 noon, the days are longer compared to the winter time, December, January, where the nights are much longer compared to the daytime periods. Okay. And so you can see that there's this big change that occurs. These other colors represent twilight. And we have, of course, very nice long twilights in the summer here in Vancouver because we're quite far north, 49 degrees north latitude. If we compare these seasonal changes in day length to different latitudes, what we see is that at the equator, Quito, Ecuador, where you go to if you're going to Machu Picchu, it's right at the equator. And you can see there is no change at all in terms of the nights and the days from winter to summer. Whereas in Greenland, much farther north, you can see that in the summertime, this area here, there's no night at all. And so that's the 24-hour sun daylight, right? The midnight sun that you see in the upper north latitudes. Also represented in the south. So that in Antarctica, you see the same thing, but of course, it's reversed. It's during their winter months, January, February, March is when they have the midnight sun. And in the summertime is when they have darkness almost the entire day. Okay. So this is interesting that we think it's related to the day length and the shorter winter days. This just shows some of the other areas in Canada. Whitehorse, again, similar. Midnight Sun. Prince George has very short nights in the summertime, long nights in the winter. Same with Toronto. They're actually slightly farther south of us. So that's, talking about winter blues and some of these seasonal changes and this dimensional aspect of seasonality. But we also talk about seasonal depression. And when we talk about depression, we're talking about a clinical diagnosis. For those of you in mental health, you know that we have a psychiatric Bible of diagnoses called the DSM-5 that sets out all of the criteria that we use to make a diagnosis. And in DSM-5, we have what's called a major depressive episode. That's clinical depression. That's when people have a lot of symptoms of depression for at least a few weeks, almost every day, to the point where it's really interfering with their functioning or causing them significant distress. So these are people who are really suffering from their symptoms and quite seriously affected. These are some of the symptoms that we experience, that we look for in people with depression. And you can see that many of the symptoms that I talked about for winter blues are represented here. Weight gain, oversleeping, fatigue or loss of energy. And then, some of these other symptoms in terms of low mood, feelings of worthlessness or guilt, and problems with their concentration and cognitive functioning. Harder to think, being indecisive, and then most seriously, and quite commonly when people are clinically depressed, having thoughts of death or suicide. So you can see this is a more serious kind of a problem at the far end of the spectrum when people are more seriously ill with these particular symptoms. Now, seasonal affective disorder, affective is actually a word, it's just a jargon word for mood. So these are seasonal mood disorders, but we don't actually have that diagnosis in the DSM-5. We call it seasonal pattern in the DSM-5, and that's when people have recurrent episodes occurring only during the winter. So in the summer, they're actually feeling perfectly well. They don't have any of those symptoms. And they have to have at least 2 seasonal episodes in the past 2 years to qualify, but most people have had many episodes, have them almost every year. Sometimes they skip a year, but it's a regular occurrence for them. So this version of SAD, the more clinical depression, affects a smaller number of people. Probably 1 to 3% of Canadians might suffer from seasonal affective disorder or seasonal pattern. We can see this actually quite well in large-scale epidemiological surveys of the entire population in Canada. And these are done on a regular basis so that we can track what's happening with medical diagnoses. And this is an example of a study that was done throughout Canada looking at how common is depression, clinical depression, the major depressive episode, as I mentioned, at any given time. And we know that at any given time, about 6 to 7% of the population actually suffers from a major depressive episode. It's very common, a very common condition. But there is this very nice seasonality in this study where the lowest rates of major depressive disorder occur during the summer. The highest rates occur in the winter months, January, February, November, December. So it looks like, from this perspective as well, that winter depression is a problem in Canada. So when we go back to talking about seasonal affective disorder and this seasonal mood change that occurs between summer and winter, the really neat thing about it is that we have a specific treatment for it. And so it's actually was first described in 1984, okay, almost 40 years ago, well, over 40 years ago now, where it was first described as a condition. And this interesting, at the time, novel, very novel treatment with bright light therapy captured the imagination of a lot of people, including myself. I was a young trainee at the time, and I ended up going to UC San Diego to study light therapy and circadian rhythms. So that's how I got started in my research career. But the cool thing about light therapy, of course, is that it's very effective for people with winter depression. Now, this is one way of getting light therapy, but it's actually not the way that we would typically recommend in terms of getting light therapy. Instead, we use a light device like a light box. So here's a good looking fellow sitting in front of this light box that we use, one of the versions. And you can see it's a large light that emits, it's fluorescent, emits a very bright light. And people have to sit in front of this light in order to get the benefits of light therapy. I always like to tell people what light therapy is not, because there are many misconceptions about light therapy. So it's not just changing the kitchen lights or the lights in your house. We'll talk about why that is, but you can't really get room light up bright enough to have an antidepressant effect. It's not just having more windows, and we'll also talk about why that is, because having more windows doesn't necessarily give you more light through the eyes, which is where it's important. It's definitely not going to tanning studios because the effect is through the eyes and not through skin exposure. And tanning studios use ultraviolet light, which is not good for you. And so we don't recommend tanning studios for treating winter depression. And it's not really a special type of light. We can talk about, the light devices use different types of light, LED lights sometimes, fluorescent lights, but they all seem to work as long as they're bright enough. So in fact, here's a protocol that we use for bright light treatment. We wrote a book about it a little while ago that's still useful, A Clinician's Guide to Using Light Therapy, where we summarize all the evidence for light therapy. And what we look at is we look at the wavelength of light, the intensity of light, how bright it is, the exposure duration or how long people need to be exposed to the bright light, and then the time course, how long it takes for the bright light to have an effect. And so we usually use a fluorescent light box because other types of light or LED lights, because other types of lights are too get too hot. Incandescent lights are too hot for the brightness. And we use 10,000 lux of white light. That's a very bright light. I'm going to talk about lux in a second to give you an illustration of what that means. But again, our studies and others have found that ultraviolet wavelengths are not necessary for the antidepressant effect. So the light boxes have UV filters, so you don't get the harmful effects of UV light. Unfortunately, you can't get a tan when you're in front of these lights either. We usually use it for about 30 minutes a day in the early morning, and I'll talk about that as well. And interestingly, it's a very rapid effect that people usually have. So usually they notice benefit starting, even a week of using the light therapy. And sometimes it takes as long as 3 or 4 weeks, but it's a pretty rapid effect that they notice. Of course, when they stop using light, the effect also wears off in the same amount of time. And so usually people have to maintain daily use through the winter season until the time that they would ordinarily be feeling better, and then they can stop using the lights. So when we talk about intensity of light, light's a very complex phenomenon, right? It's a particle and a wave. There are many different ways to measure light. But the way we use for our purposes is with a unit called lux. And it's a photometric unit of light illumination. And just to give you an idea of lux ratings, at home in your living room at night using, ordinary room light is usually less than 100 lux. A very bright office or a very bright kitchen, let's say, would be somewhere between 3 and 500 lux, which is quite a bit lower than outdoor light. So even on a cloudy day outdoors in Vancouver in the winter here, you get 3 to 5,000 lux of exposure. And direct sunlight can be 50 to 100,000 lux or more. So you can see it's a very broad range of intensity of light. And when we use 10,000 lux, we're using about outdoor light, but much brighter than you can get room light, at least 5 to 10 times as bright as the brightest room lighting. The other important thing about lux is that the lux rating actually falls with the inverse square of the distance to the light source. All that means is that the farther you get away from the light source, the lux rating drops rapidly. Okay? So that even if you have a window on a bright sunny day, as soon as you get 2 feet away from that window, you're back at room light. So you're getting none of the benefit of that outdoor light because the lux rating drops so rapidly. And that's important when we're talking about light devices because to get a 10,000 lux rating from a light device, they have to specify the distance that you have to be away from that light source in order to get that required lux rating. So that if you sit farther away than recommended, you're not going to get the benefit of the 10,000 lux. So that's the importance of lux and bright light for treating winter depression. It's a very good treatment. About 60 to 70% of people get much better with this bright light treatment. So why does light work, and why do people get sad? Well, unfortunately, like most of our psychiatric diagnoses, we don't know the exact reasons why. We're all trying hard to discover some of the reasons, some of the biological explanations, but we don't really know. But there are some major theories, and there are some theories related to what we know about light and its effect on our bodies. So some of these major theories include a disturbance of the biological clock in the brain, genetic vulnerability, because it does seem to, there is a genetic factor involved, neurotransmitter disturbances like serotonin or dopamine, and then various theories about perhaps changes in retinal light sensitivity or immune function changes or psychological factors. But we're going to focus a bit on biological clock disturbance because it's such a neat science story and also because we know a lot about how light affects our biological clocks. So what we know is that there are circadian rhythms in our bodies. And by circadian, we mean 24-hour rhythms. Okay. And so, for example, things like body temperature. Our body temperature has a nice circadian rhythm where the highest body temperature is during the day, lowest body temperature is during the night, and it repeats on a daily basis. Same with hormones like melatonin, which is secreted only at night. And so you have very low levels in the day, high levels at night, and then low levels again in the day. This circadian rhythmicity. Same with hormones like cortisol, which is the stress hormone. Again, lowest levels at night, highest levels first thing in the morning and through the day. A nice 24-hour rhythm of cortisol. And growth hormone shows a similar pattern. But it's not just hormones and physiology, it's also behavior. So, for example, making errors on a cognitive test, there's actually a circadian rhythm. So that our cognition and the number of errors we make is low during the day and highest during the night. Okay. And there's this nice circadian rhythm of making errors on a performance task. These daily rhythms are really controlled by a biological clock in the brain. And so there is a master clock that's been identified in the brain. This is a cross-section of a brain. Here's the eye here. And deep in the brain, in the hypothalamus, is a small cluster of cells called the suprachiasmatic nucleus. And it is the master clock for all circadian rhythms in the body. Okay? It controls circadian rhythms, and one of the main circadian rhythms, of course, is sleep. So our sleep-wake cycle is an example of a circadian rhythm that's controlled in part by the master clock. What we know about this master clock, though, is that in the absence of any synchronizers, it actually runs longer than 24 hours. And so in order to keep a 24-hour rhythm, it has to be synchronized to 24 hours. And the way the clock gets synchronized, the main synchronizer is bright light. And so the bright light passes through the eyes, sensed in the retina, and there's a clear pathway leading from the retina to the master clock in the brain that transmits the light signal to be able to synchronize the clock to the external day-night photo period. Okay? And we know a lot about this, that, bright light can synchronize the clock. Bright light can also shift the clock in a way like jet lag. And so we can shift circadian rhythms using bright light at appropriate times. Morning light is especially important for proper synchronization of the biological clock. So the dawn signal is more important than light at other times of the day or the dusk signal in terms of synchronizing this clock. And so in order to get proper synchronization and proper circadian rhythms of our hormones in our sleep, we need to have appropriate bright light exposure. I mentioned that we use bright white light, but we know that light has different frequencies or wavelengths. And so you can separate white light into red, green, and blue light. Okay. The interesting thing is that the photoreceptors that transmit the light signal to the biological clock are not the same as the photoreceptors that we use for vision. So you know about rods and cones. Rods photoreceptors help you see at night. Cone photoreceptors help you see in the daytime. Those aren't the photoreceptors that actually transmit the bright light signal for the master clock. That's actually a photopigment called melanopsin that's present in retinal ganglion cells, not in the photoreceptors. So it's a separate system that transmits the light to the master clock. That kind of makes sense because the master clock, is actually present in all living organisms, from one-celled amoeba all the way up to mammals. And we know vision, of course, is a much later evolutionary process. And so it makes sense that something like the master clock, which is so essential for life, is actually controlled by a different system, a much earlier, more primitive system. Anyway, the point of this is that melanopsin is actually much more sensitive to blue light than other wavelengths. So you can actually control the master clock or change the circadian rhythms using much lower intensity blue light, even room light. Room light intensity can affect the master clock if it's in the blue range of the spectrum. Okay, it's very interesting. That, for example, that's one of the reasons why we recommend not having blue light screens late at night when you're because that might interfere with sleep through altering the circadian rhythm of sleep. Okay. So perhaps low-level blue light might work for treating winter depression if it's through this circadian hypothesis. Well, unfortunately, the studies that have looked at low-intensity blue light have really shown inconsistent results for treating depression. So it hasn't been clear that blue light, low-level blue light, is better than placebo conditions. And compared to white light, it appears that white light might be a little bit better. And so we're not sure about low intensity blue light. And there are some theoretical risks for toxicity of the eye with chronic blue light exposure. Probably not at low intensity, but we're not sure. And so, we don't recommend blue light. We still recommend bright white light for depression treatment. And because of this, there are some aspects that we're not sure that the light actually works for depression through this circadian biological clock theory. And so if we look at other theories for why light therapy should work, we can look at things like neurotransmitter problems, serotonin or dopamine disturbance. And that's kind of interesting because, of course, serotonin is well known to help regulate mood. And in fact, our antidepressant medications, many of them work by altering serotonin. Okay. Well, we can measure serotonin in many ways. One way is through positron emission tomography or PET scans. These are brain scans. And we can measure, we can find ways to assess the level of serotonin in the brain. I'm not going to go into the details of how that works. It's kind of complicated. But basically, some of these studies, and this just shows a PET scan of a brain. I wouldn't be a brain researcher without showing a PET scan or a brain scan. Some of these studies found that SAD patients actually had lower serotonin levels as assessed by PET compared to healthy people in the wintertime. But there were no differences between SAD patients and healthy people in the summertime. There were also studies showing that when patients with SAD were treated with light therapy, it showed increases in serotonin levels in the brain compared to after treatment compared to before treatment. So this is kind of consistent with the fact that there may be serotonin disturbances in people with SAD that is corrected by bright light exposure. Well, if that's the case, then maybe bright light could be used to treat other conditions that serotonin is involved in, like non-seasonal depression. And lo and behold, yes, light therapy does seem to be effective for other types of depression as well. There's actually different ways that we can use light therapy for non-seasonal depression. I'm not going to go into that right now, but I'm going to mention a study that we did that's gotten a lot of attention, where we looked at treating people with light and with an antidepressant medication, which in this case was fluoxetine or Prozac, against a placebo condition, a sham, an inactive device. And so we took 122 patients who had non-seasonal major depressive disorder. Okay, they were depressed, acutely depressed, and we randomized them to. They all took a pill, and they all used a device for 30 minutes a day in the early morning, like I mentioned. But half the pills were placebo pills, sugar pills, and half the pills were Prozac. Half the devices were active light therapy devices, and half the devices were sham inactive devices. And so people either got an inactive device plus a placebo pill, or they got an inactive device plus Prozac alone, or they got active light box and placebo pill, or they had the combination of light and Prozac. And neither the patients knew what they were getting, and neither did the people who rated them know what the patients were getting. This is what we call a double-blind study. And just to show you, this is the only chart I'm going to show. So don't worry, I'm not going to show a lot of data from studies. But what we found was very interesting that, in fact, if we looked at people who were feeling better after the end of 8 weeks of treatment with whatever condition that they got, and people who were feeling well, perfectly fine, did not have a lot of depressive symptoms by the end of 8 weeks, we found that, in fact, the light therapy in yellow here did better than the placebo condition, which is here, 50% versus 33%. The Prozac did well, did okay, but not quite as good as the light therapy. But it was really the combination of light therapy plus Prozac that seemed to have the greatest benefit for these people with non-seasonal depression. That was true as well, looking at people who were well after 8 weeks, so a even better response that they got. And you can see that again, the combination treatment did best. The light therapy did pretty good. Prozac not quite as well. And then the placebo condition here, not many people got better with the placebo condition. Still interesting, though, that some people got better with placebo, and so that's why we have to do these double-blind studies because placebo actually works pretty good in clinical trials of depression. So this is very interesting, but it was really the first study to show that light by itself was effective for non-seasonal depression, and that the combination was better than either treatment by itself. Since then, many other studies have looked at this, and it's very clear that light therapy is also effective for non-seasonal depression. So it's not quite as specific of a treatment as we thought for people with winter depression. So just to summarize what we talked about, light therapy shows efficacy for both SAD and non-seasonal depression. Light has very complex biological effects. It has clear effects on the biological clock, although we're not quite sure whether that's the reason that people get better with depression. And it has effects on neurotransmitters as well, like serotonin, which might also explain its effect on people with depression. And it also suggests, and there are studies now showing some benefits in other treatment, other conditions. I won't have time to talk about those today, but bipolar depression, bulimia, which is an eating disorder, has a seasonal component as well. Binge eating disorder, premenstrual and perinatal postpartum mood disorders may benefit from light therapy. And even attention deficit hyperactivity disorder, ADHD, there are some studies showing benefits of light therapy for those people as well. So let's finish up then in the last few minutes with my 5 top tips for you to help beat the winter blues. So even if you don't have seasonal affective disorder, you have seasonal changes, don't feel quite as well in the winter compared to the summer, here are some things that you can do to improve your feelings during the winter time. First one is you can use light therapy. So it turns out that light therapy not only helps people with the more severe forms, but also helps people with milder forms of the winter blues. Okay. And so it's easy to do. 30 minutes a day, starting in the early morning, as I mentioned, using a light box. You have to have your eyes open because the light does come in through your eyes, but you don't have to be staring at the light. You can read, look at your screen, eat breakfast, but you have to make sure again that the light box is close enough to you in order to get that 10,000 lux. And these are available now, at drugstores, through the internet. The cost is between $100 to $300. And I will mention that, some of the smaller light devices that are sold like at Costco and are very cheap, we don't usually recommend those because you have to sit so close to the light. If you read the instructions, it says you have to be like 4 inches away from the lights. So that's why we recommend these larger lights for use. There's a nice website, Centers for Environmental Therapeutics, CET.org, that has a lot of information on how to choose an appropriate light device. Tip number two, spend more time outdoors. Okay. That makes sense because, of course, I mentioned that outdoor light much more bright than indoor light, and especially morning light is particularly good. So even on a gray, rainy Vancouver winter day, the outdoor light is at least 5 times as bright than the brightest office lighting. And the cost for that, of course, is free, right? Going outside. So that's something that you may want to consider in terms of spending more time outdoors and getting more natural light. Tip number three, exercise. I'm sure you've heard about exercise from other talks in this series. Exercise is great for you. It's great not only for your physical health, but for your mental health. And so we really do recommend exercise. It's actually a pretty effective treatment for depression by itself. And so these are some of the benefits that you get from exercise, not just improved mood, but improved energy, better brain health, reduced anxiety and depression levels. A lot of good things happen with exercise. And so we do recommend exercise for people with winter depression, as well as other types of depression. The good news is the amount of exercise is similar to the recommended amounts of activity. So, 3 to 5 times using, moderate exercise for 20 to 30 minutes a day. How about a noon walk? That might be helpful as well. Even that amount of exercise may be helpful. And you're also outside, so you get the benefits of the light as well. And the cost, of course, for exercise is also minimal. Okay, tip number four, keep a regular sleep schedule. Now, why is that important? Well, I told you that the master clock is helps control our sleep. And when we sleep and if we keep a regular sleep schedule, going to bed at a regular time, I'm sorry, I gotta plug in my computer. Well, I'll try and see if we can make it. That keeping a regular sleep schedule helps to set that master clock. And so sticking to a consistent schedule, making sure you have a good environment for sleep, avoiding caffeine, and practicing relaxation techniques, all of these things are helpful in terms of improving your sleep quality and helping to regulate the biological clock. So tip number five, and this is the one I thought might surprise you, and the cost of improving sleep quality, of course, free. So tip number five is use a sunrise light clock. Now, what do I mean by a sunrise light clock? So these are clocks that have a light that sit on your bedside table that gradually increases the light. You set it on a timer, and instead of the radio coming on or something like that, the light gradually increases in intensity to simulate a summer dawn in the wintertime. And I mentioned to you that actually the dawn was more important signal for our master clock than light at other times of the day. And so even lower levels of light simulating this summer dawn might be.
Oh no. His laptop seems to have given up, so maybe we'll take a few moments to until he's back. Sorry, everybody.
Do we have any other questions that want to be shared in the chat? In the meantime, I see some good ones while he's away.
I
Yes,
wouldn't mind asking about the summer clock. Do you know where you can get those?
let's I believe it's online that you can
Okay.
find those between, yeah. Um but curious to see if there are any on that site that he mentioned, WWCEG. I know those are more of the light therapy devices, but good questions to keep in mind for when he does come back, which hopefully is shortly. Thank you, Catherine.
I'm sorry, but I have to leave for an appointment, so I'm going to leave now. It's
No,
been very informative, and I thank you very much.
thank you for being here. Have a good day. For everyone who does not have to go, he will likely return. So
Yeah, Amazon had them for $39.99.
amazing. Thank you for looking that
Just look them up.
up.
Thanks, John. Can I ask another one? I've got all these questions. Can you see him?
Yes, can you not?
No, I mean in real life.
Oh,
Yeah,
I'm unsure about that, but I'm happy to address the question to him.
okay.
Yeah.
Because I have a lot of areas in this area, and I didn't realize how huge it was of all the things I'm going through. And
Mm,
I'm like, what? So somebody who specializes in it might be the person to see.
I will ask him that, yeah. And he is back.
Sure. I usually get more warning than that when my battery is about to run out. So very sorry. I'm just near the end of my thought.
I'll just let you know that the audio is a little bit muffled. We can't hear you too well.
Oh,
We cannot hear you well, unfortunately.
how's that? Is that
Great.
any better? Okay.
Yes,
Okay,
thank
we're
you.
back. All right. So this sunrise clock is interesting because it's fairly cheap, and so it seems to be helpful, particularly to help people wake up, because it's easier to wake up into light than into darkness. And so this is something that may be able to help a bit with winter symptoms. Now, the studies are a little bit inconsistent because some of the studies showed that it was no different using this gradual dawn compared to just having a timer turn on your lights immediately. And so that's also something, if you want to try that, that's much cheaper than setting your lights on a timer just to turn on. Because again, as I said, it's easier to wake up into light than into darkness. But this is something that may be useful for some people using a sunrise light clock. So here are the 5 tips that we've talked about: using light therapy, spending more time outdoors, exercising for mental health, keeping a regular sleep schedule, and using a sunrise light clock. And of course, many people use a combination of these methods in order to help with their winter symptoms. I just want to finish up by saying that we have a nice website, ubcsad.ca, that has a lot of information about SAD and light therapy, including instructions on how to use a light device and how to get a light device, and then some good websites include the Center for Environmental Therapeutics, cet.org, as I mentioned. And if you're really interested, there's a research society that we have called the Society for Light, Rhythms, and Circadian Health. That's the website there. If you want to have a look at that, we hold meetings and other resources for people interested in the research into these conditions. So I'll finish there, and hopefully, unlike this slide, I'm happy to answer questions for you.
Amazing. Thank you very much for that useful presentation. We just, while you're away briefly, already had some questions come up.
Okay.
Um, so some people were wondering about specific brands or where to get some of these devices. Would these be listed on that website you mentioned?
They are. We have recommendations for a couple of Canadian manufacturers that you can purchase over the internet. I want to mention specifically that I have no conflicts with this. I get no funding from any light companies or light device companies, and there's no funding for our website. It's entirely, with our research funding. And so we don't have any conflicts that way. But we do make some recommendations. And it's really just important to know what the parameters are because make sure that any light device you buy fits, the recommended parameters.
Great, thank you. Along those lines, we just got a question. Is the lux time relationship linear? If you use 100,000 lux, like going outside, do you only need to sit in front of the light for 3 minutes?
Yeah, very, very good question. A very good question. It looks like again there's a threshold, and so in terms of the effects on biology for bright light, and that threshold is probably around 1500 lux. And so that's why room light doesn't really affect our circadian rhythms, except possibly for times when we're more sensitive to the light, like in the early morning or the late evening. And that's why even screens, right, may affect our sleep for that reason. So that what that means is that you can't use your, indoor light 500 lux for 20 hours to get the same amount of time. The reason we use 10,000 lux as the upper limit is only because any more light than that from a light device is too bright and there's too much glare. And so it's not very comfortable. And so that's kind of the maximum for comfort, this 10,000 lux for 30 minutes. Going outside, of course, might be helpful. But as I mentioned, light in the regular part of the day actually doesn't really affect our master clock. It's very interesting. It's really only light in the early morning and the late evening that affects the clock. And so it doesn't really matter how much light you get. 100,000 lux, it may be this important time in the early morning. And that's when we recommend getting the light therapy. That's important. And during that time, it's not usually light out, at least here in Vancouver.
Hmm. Along those lines, someone was wondering what to do if they find it hard on the eyes to sit in front of the light boxes.
Mm-hmm. So sometimes there are some side effects to light, and so people need to be aware of those. They're generally mild and not so much of a problem. Certainly less than for medications, for example. But people can have some eye strain or blurred vision. Occasionally, people feel a bit nauseous under the light. Sometimes it makes people feel a bit agitated when they're under the light because there is a activating effect of the bright light. In those cases, usually we just recommend sitting a little bit farther away so that you're not getting quite as much the intensity of light, hopefully still getting enough of the bright light. That's usually enough to settle things down from that perspective. But there are occasional people where they just aren't able to use the lights.
Hmm. Very interesting. Um, does light therapy do anything for non-depressed people or people without any other disorders? Like, can it make happy people even happier?
Yes, no one's looked specifically at that. Again, as I said, people have looked at people with these milder symptoms of winter blues and find that that definitely helps. Um, Interestingly, it may help with things like concentration. And so, in terms of, being able to focus better. So there may be some benefits that way, even in, kind of completely healthy people. But as far as we know, it doesn't make people even happier. Although I will mention, because the one concern we have is in people with bipolar disorder. And people with bipolar disorder, they have depressions, but they also have the opposite of depressions. They have manic episodes where they feel too high. They're racy, they have racing thoughts, they're talking too quickly, they're moving too quickly, and they often have unusual experiences like hearing voices or seeing things, or they feel like they have special powers. So these are people who have really serious conditions. And for those people, um, we say you have to be careful with the light because the light can precipitate or set off a manic episode in the same way that antidepressant medications for those people can set off a manic episode. So we're careful about that. People have to be on mood stabilizers before using light therapy if they have bipolar disorder. And this
Mm.
is bipolar type 1 disorder with manias. Bipolar type 2 with less severe hypomanias is a different issue that we don't need to be quite so careful about.
Thank you. We did actually have a question on that, so it's great you addressed it.
Now, light therapy has been used for bipolar depression, even bipolar 1 depression. It's
Mm.
just that you have to be careful. Uh, they tend to be more sensitive to light, so we usually use slightly lower intensities and for less time. So we usually start people at like 15 minutes to see if how it's going to affect them first.
Mm. Another question we had was, given the fundamental role of seasonal cycles in nature, why do modern humans struggle to adapt to them? Might examining historical or indigenous ways of living offer insights into healthier seasonal practices?
Well, of course, we're animals. More than anything else, we should be living, in the natural world. That is not going to happen. We
Mm.
are, we are, I won't say forced. We choose to live in an artificial environment. I think most of us wouldn't have it any other way. And so, it's important to try to adapt to it as much as possible.
Mm. And do you have any resources on comments on how women's menstrual cycle is also impacted by seasonal affective disorder?
Yes, as far as we know, it's not so much their menstrual cycles that are impacted. It's that many women have premenstrual, syndrome, what we call premenstrual dysphoric disorder, where they have, quite troublesome mood changes in the, days in the premenstrual period. And many of those women have seasonality so that it gets worse in the wintertime compared to the summer. And so that's where light therapy has been studied for those women, and it does appear to have some benefit. It's small studies. We don't have the same degree of evidence, but it does seem to be helpful for them as well.
Hmm. And I think we have time for one more question. We've gotten multiple on blue light protectors and blue light glasses and such, and the efficacy of that, if you can speak to that
Yeah,
for
so
phones and such specifically.
sure. And part of that is, there are disturbances of the biological clock, like jet lag is a classic example, right? Shift work, where our internal clock is mismatched to the external clock. And so that's where we know that to help with jet lag, you can actually use appropriately timed bright light to be able to help shift your rhythms to the new time zone. But you also have to avoid bright light at the wrong times because it could shift you the wrong way. And so if you Google jet lag calculator, you'll find websites that will help you, depending on how many time zones you're crossing, what your usual sleep is like, to tell you when you should be seeking bright light, like spending time outdoors, and when you should be avoiding bright light, like staying indoors or using blue blocker glasses. The blue blocker glasses block the blue wavelengths and help to reduce the amount of light that will shift your clock. And so that's where blue blocker glasses are helpful. people are looking at blue blocker glasses to help with like people with manic episodes to see whether it might help. So some of those studies are still ongoing.
Okay, thank you very much. In the interest of time, if anyone else has any more pressing questions for Dr. Lamb, you can send us an email and we will forward them to him and then get back to you. But of course, he cannot give any clinical advice. And yeah, this is the official end of today's event. So thank you very much again, Dr. Lamb, for the engaging presentation. I hope we can indeed beat the winter blues. And thank you everyone for joining us. And we wish you all a lovely week.
And there was a question about whether I was retired, but I'm not retired, Joe. Not yet. Okay.
Interested in whether you
Oh,
if they
someone who knows me. Who knows my wife, actually. So,
Mhm.
okay.
Everybody.
Thank you. It was hugely informative and you explained it all so clearly. Excellent.
Thanks. Okay. Thanks, Romina.